Kevin, is the waiting room empty now? Okay, good. Good morning, CFGG friends. Welcome to the Community Foundation's monthly webcast on adaptive philanthropy in times of change. I am Emily Thompson, Director of Donor Services at CFGG, and I'm thrilled to be here today with you as we speak to Dr. Iulia Vann about healthcare in Guilford County. Michelle Lewis, CEO for Triad Adult and Pediatric Medicine, was scheduled to be here today with us, but is not able to join us. And of course, we are wishing her good health and hope that we will see her again in a future session. Before we speak with Dr. Vann, I want to make sure you are aware that we are recording this session as all the other sessions have been recorded, and we will share it on our website and social media. So if you would like for someone else to see it, you're always welcome to share this with others. We're also asking you that you make sure you mute your microphone. And to help this run efficiently, we're also asking that you put any questions that you have into the chat box, and we will answer those questions at the end as time permits. At the end of our questions, my colleague and a familiar face to most of you, Kevin Lundy, will offer a quick reflection of our time together with Dr. Vann. As we have all experienced over the last 7 months, the COVID-19 pandemic has brought to light many challenges and inequities in our city, but also opportunities. We have seen firsthand how our community can be resilient, resourceful, and innovative. Today, we have Dr. Iulia Vann, the Health Director at Guilford County Public Health. Dr. Vann has served as the Assistant Director in Guilford County and held similar positions in Orange and Hertford counties. Here in Guilford County, Dr. Vann's efforts have been crucial in continuing the long-standing history of the agency promoting and protecting the health of the community, including the establishment of a COVID-19 testing campaign for residents at the highest risk in Guilford County while working with area partners. Her expertise has allowed the agency to evaluate ways to further expand services in the areas of communicable disease, emergency preparedness, immunization tracking, refugee health, clinical, allied, and community health services. Dr. Vann obtained her Doctor of Medicine degree from the Carol de Villa University of Medicine and Pharmacy, Bucharest, Romania, and her Master's in Public Health Analysis and Management from East Carolina University. When I first met Dr. Vann, as we were preparing for this session, I immediately found her to be warm and caring and someone we will all wonder how the time went by so fast while talking to her. So if you will, let's get started. Good morning, Dr. Vann.
Good morning, Emily, and everyone else on the call. I hope everybody's having a wonderful morning.
Great, thank you. If you would you mind taking just a few minutes to give us maybe a less formal introduction than I just gave about how you came to Guilford County and the initial thoughts you had of Guilford County when you first arrived?
Sure. So first of all, I wanted to say, again, thank you so much for inviting me today. It is an honor and a pleasure for me to talk to you and to your honored guests today and to share some of my experiences and some of the work that we're doing and to take any questions and bring any type of information to the group. So I've started in Guilford County approximately 1.5 years ago, just like you've mentioned, initially as the Assistant Health Director at the Health Department under the mentorship of Dr. and Ms. Merle Green, who has been the Health Director for a very long time prior to her retirement at the beginning of this year. After her retirement, I was named interim health director in the first week of March, which also coincided with the first week in which we have seen a COVID case in North Carolina. So I've served in that position for approximately 2 months. And after that, I have been given the tremendous honor of serving as the permanent health director here in our county. It has been definitely a very interesting time for me to be a new health director during a pandemic. And it has definitely challenged all of the skill and training and experience that I have gathered so far to be put in place during this time. Prior to me being here in Guilford County, I have served in a similar position in Orange County, Chapel Hill, Hillsborough area. And prior to that in Hereford County, which is in northeast part of North Carolina. I've always known that I wanted to come to Guilford County because being in public health, you hear about all of the other things that other health departments are doing, and all of the innovative and creative ways that this health department here has been made itself known across the state has been one of those focuses for me, and always wanted to know that I always knew that I wanted to be part of this this family and the work that is being done here. So I came to Guilford extremely excited. My growth goal has been to become a health director one day. So I came opened to learning and finding out everything that I can from Ms. Green, and being extremely hungry to learn how she's doing this work and how can I become, you know, and be able to be in that position one day. So it has been a steep learning curve from the leadership part of things, and to learn how to be in this position in a very effective but also collaborative way. But it hasn't been a steep learning curve from the science of public health, because I have been doing this for years before coming here. So that has been a pretty smooth transition. The first thing that I've noticed about Guilford County is that the team in the health department is absolutely amazing, with a very unique combination of veteran members of 25 years plus, and also new and fresh team members that are just complementing each other in such wonderful ways. Another thing that I've noticed are all of the collaborations that the health department has across the board, not only in healthcare services, but also just human services altogether. So that was extremely exciting for me to see that the health department is really placing itself in the community, not by itself on an island, but in collaboration with so many others. And then the third thing that I've noticed was a very interesting distribution of the county as a whole, with metropolitan areas and urban areas, suburban areas in our northwestern part of the county, but also rural areas. So it's just such a interesting dynamic from that perspective. Coming from Hereford County, which is rural, low socioeconomic status, with a lot of resources that are needed in that community, and trying to make things meet, and thinking very creatively on how to spend $5 for 10 people. And bringing in the experience in Orange County, which is highly affluent, with a lot of resources and a lot of community members that are in a very high socioeconomic distribution. I felt like I could bring both of those experiences and put them at work here in Guilford, because we have such a dynamic distribution here in our community. So that's just kind of where I come from, a little bit of background on me, and what my response, or, you know, kind of what my first thoughts were coming here in Guilford.
That is great. We are so lucky to have you here in Guilford County, like you said, because you have had the experience of so many different areas, and we're really lucky to have you here now. So for those of us who may not be familiar with them, how would you describe health inequities and disparities? And maybe could you sort of set it up and give us a little bit of history about how the inequities and disparities have shaped where we are today?
Oh, sure, absolutely. So talking a little bit about health equity first. So health equity is pretty much the absence of avoidable differences, allowing for the attainment of optimum health for all people. So it's achieved when everybody has the opportunity to achieve their full health potential, and nobody is disadvantaged because of social determined circumstances. And it focuses on the ongoing efforts and addresses avoidable inequities, historical and contemporary injustices, to address those health disparities. So this is pretty much what health equity is, and that is what our focus is. That's what we want to achieve in the work that we're doing in the health department every day. What health inequity is the exact opposite of that, which is an unfair health difference, which is very closely linked to social, environmental, or economic disadvantages that adversely affect certain groups. Not everybody, but certain groups of people. So inequity involves more than inequality with respects to health determinants and access to resources, but it also represents a failure to avoid those inequalities and those things that are impacting somebody's health. So it is a construct that we need to break down and address all of those different things. So disparities, on the other hand, they're all intertwined, but they just have very slight differences in the way that we're thinking about them, are measurable differences in health status between people that are related to social or demographic factors, such as race, gender, income, geographic distribution. So I'll talk to you a little bit about racial inequities. I will talk to you a little bit about the gap in life expectancy that is based on zip codes. And I will talk to you a little bit about the overall health distribution in Guilford County that is impacted by those health inequities. Mm-hmm. So I think that kind of answers the first part of your question, and the second part, I think it was around how do we see that here in Guilford, right?
And how the history is shaped, yes, in Guilford County.
Yes, so it is very interesting to see how public health's role has shifted in the decades that we've been doing this work. So initially, public health has been very much focused on communicable diseases, on sanitation, making sure that we have all of these things put in place in order to prevent those illnesses. As time went by, we started focusing more because we did such a great job with that work. We started seeing that a lot of the health issues that are in our communities are more chronic illnesses. So talking about chronic heart disease, diabetes, hypertension, stroke, all of these chronic illnesses that have been shaped by our community, our environment, our economy, our way of life, and the way that we live our lives in the 21st century, pretty much. But we realized also that in the most recent years, as more research is done and as more boots on the ground are seeing and doing this work, that it is not only the fact that we need to prevent stroke by getting some type of screening tools out there, or breast cancer by promoting more mammographies, or colon cancer by doing more colposcopies, because it's all intertwined with the environment that that person lives in. So that's when we realized that social determinants of health, or all of the different factors that are impacting someone's health, are crucial in creating a healthy environment in our communities. So that has been kind of the path that public health has taken in the, like I said, the tens and hundreds of years that we've been doing this work. Oh, and I do want to mention the fact that the Guilford County Health Department is the first health department in North Carolina, and we have been around for over 120 years. So it is not only an honor to work with my team and the community here, but it's also an honor to be part of this historic path that Guilford County Health Department has put in place in our state. So it's very, very exciting.
It's exciting.
Yes. So I hope that kind of gives a little bit of idea of kind of where we were and where are we going and what our path is.
Mm-hmm. That's great. That's great. And I'm so happy you're lifting up all of these points about Guilford County, because I don't think, when you said, you wanted to work at Guilford County, has such a great reputation. And now that I know that's the oldest, I had no idea. So thank you for lifting up those things. So shifting just a little, well, kind of a little bit, but how has COVID now changed this work? So when you and I spoke, it was that COVID just is sort of highlighting it all, right? So tell us about that. How has COVID changed it or kept it the same, or talk more to us about that?
Sure. So COVID work has been incredibly interesting and challenging at the same time, but also as weird as it might sound, also uplifting and exciting because of the opportunities that we're seeing coming towards us into our communities. So we've been preparing as the health department in our preparedness response is first responders in any type of public health emergency, from outbreaks to new communicable diseases to bioterrorism. We do this work all the time. We have exercises and scenarios and plans, and we do this every year. We're getting ready to do it. But the trick has been that we are using diseases that we know about. We do scenarios about salmonella outbreaks or some type of measles outbreak. So, we use things that we know about. The COVID-19 response has been so much different in all of these plans that we are very familiar with, because we didn't know that much about the illness, the virus, the disease, how it impacts the community. So it's just been such a constant learning and constant changing and flexibility. So that has been one of the major aspects of our response that maybe we don't talk that much about. You hear a lot about the testing and the case investigations and the numbers, but you don't hear too much about the work that is being done to stay abreast with all of the different things that are changing, from the CDC to the North Carolina DHHS and the World Health Organization. But it's my belief that as public health professionals that are truly taking this positively, we can only take that information. So we have team members that are constantly looking at research papers. They're reading the most the newest data that's coming out of different universities in different countries around the world to look at that data, so we can have our own idea of what's going on and lesson learned, best practices, how can we address different things going forward. So that is just kind of like one part of the work. But then we are continuing to do testing, case investigations, contact tracing, all of the good stuff that you always hear about. But it all merges with the topic that I was just talking about earlier about health inequities and social determinants of health. And for a long time, we've been hearing about how our Black and Brown community members are more likely to be negatively impacted by COVID, or our Latinx community members. And it just became a little bit of a phrase that is being used that I don't really know that we really understand what that means and why is that. It's not because of their race or ethnicity or because of their background or where they're coming from. It's because of all of the encompassing areas that have been lacking or have been diminished or they did not have access to prior to COVID. So let's talk about some of the examples to just kind of get our listeners and viewers to understand social determinants of health. What are those? So income, education, employment, all of those are part of what makes somebody healthier or not. Infant death rates, access to equitable maternity care and prenatal and postnatal care as well. We're looking at homicide, suicide, people that don't have health insurance. Also, we're looking at the incarceration rate and the way that is impacting the health of our community. So all of these together are creating these factors. So going back to what I was saying, that COVID exposed some of these issues to wider in our community, have been based on these issues. So we've known in the health department, because we're doing community health assessments, we're doing state of the county assessments every year or every 3 years for the community health assessment. So we're analyzing these on a daily basis. But I don't believe that our community as a whole was able to really understand the magnitude of these challenges that our community has. So for example, a African-American person might be impacted by COVID more than a white person because they might have not had health insurance. They did not go to the doctor to address their chronic diabetes, for example. So now that diabetes is uncontrolled, which is creating that really negative platform that COVID is acting upon. Another example would be somebody that, for example, is smoking or is having an unhealthy weight or not having the diet that they need to have. Somebody that is working 2 jobs and that has 4 kids at home that they need to worry about to put a roof over their heads and pay bills, it's probably not going to go to the grocery store and have the financial ability to buy organic foods and make salads and healthy foods for their family every night. They're going to try to find the cheapest foods or groceries that is going to feed that family, that is automatically putting them at a higher risk. So when COVID impacts that family, they're going to probably have more negative outcomes than somebody that is really able to exercise. They have a gym membership, they have access to walking trails, they can go to the grocery store and they can really pick and look at the let's say the tags on the food and look and read about those ingredients and the preservatives or the negative items that are put in those products. That's going to be a difference there. So talking about product labels, that adds the education piece in there. Somebody that is highly educated, that knows how to even read those labels, to read about calories, to read about sodium and potassium, and read about how the vitamins in it or the sugar levels. They're going to make better choices in their purchasing than somebody that's probably only looking at how much it costs because they only have $10 in their pocket and they need to be able to maximize that. So those are some of the issues that COVID is exposing in our community. And when you hear that our Black and Brown community members or our Hispanic community members are more affected by COVID, it's not because they have some type of magic attraction that COVID is going to come to them and affect them, but it's because of their the inequalities that they have been experiencing for many years that is driving this. So they tend to have more frontline jobs in grocery stores, in gas stations, in manufacturing plants, in farms. They tend to not have office jobs or jobs that allow them to work remotely. And of course, they're going to be more at risk for that. So it's a lot of, it's a big conversation about that, and talking about life expectancy. So I know that this is probably going to blow somebody's mind when you think about the fact that somebody's life expectancy is dependent on the zip code that you live in. And that is here in Guilford County. And I can definitely tell you that overall, Guilford County's average life expectancy is 78 years old. So that means that an average, a person that lives here in Guilford County is going to reach the age of 78. That is considerably lower than Mecklenburg and Wake County, and their average life expectancy is 81. So if you live in Wake County or in Mecklenburg County, you're probably going to live 3 years longer than if you live here in Guilford. When you break it down by zip codes or census block, it gets even more stunning. People that live in Greensboro, in the kind of eastern part of Greensboro, southeast Greensboro, they have a life expectancy between 65 and 72 years old. But people that live in the northwest part of Guilford County, kind of in the Summerfield, Oak Ridge area, they have a life expectancy of between 82 and 87 years old.
Wow.
So you're talking about almost, over 10 years, 12 years difference based on where you live.
Wow.
So that's the level of disparity that we're talking about.
Thank you for sharing that. That is, that's incredible. So comparing us to other counties nearby, you just touched on it a little bit, that the life expectancy is higher in other places. But talk more about that, about your knowledge of other, and how we compare more to them.
Yeah, sure. So I can talk a little bit about the some of the counties that I have worked in, and looking at some of those differences. First, I would like to start by saying that there is a place that you can go online and you can see some of these data points in comparison to different counties in North Carolina and how they compare to each other. So if you Google North Carolina health rankings, it takes you to a page where the health rankings are listed with different data points, from economic to social to health to educational areas that are being analyzed, and counties are compared to each other. Right now, as of 2020, I believe that Orange County is ranked #1 in North Carolina. So the health status of the community in Orange County is at the top level around the entire state. They meet every single one of those different data points at higher or at the level, pretty much. Guilford County ranks 22 as of this year. So we have some work that we need to do in Guilford County in order to get into that top 3 counties in North Carolina. When I think about Hertford County this year, I don't know the number exactly, but that county specifically is probably in the bottom 10 because of all of the different areas that are performing so poorly. So that's just kind of a piece of information. If anybody is interested in looking at those, the North Carolina health rankings give you a really nice nice picture of all of that. You can choose different counties and you can compare them to each other. You can look at data a little bit more granular. So it's really interesting to look at those things.
That's very cool. Yeah.
Compared to Orange County, Guilford has a higher population of refugees than any other county. Actually, I said compared to Orange, but I guess compared to the majority of the counties in North Carolina, we have a higher population of refugees than any other counties in North Carolina. So that means that we have this highly vulnerable population here that need all of the help and the resources that we can to offer them, because they are coming in this country as refugees from different parts of the world. We have refugees from Myanmar, which is Burma, what used to be known as Burma. We have refugees from the Democratic Republic of Congo, from Vietnam, from Syria, from many other places in the world that are being affected by civil war and other unsafe environments. And they come to United States with a lot of chronic illnesses, a lot of health disparities. They don't speak the language, they don't know the resources that are available, and it is just a complete and dramatic change for them. So that's one difference. I think that we're doing very well when it comes to access to care compared to other communities. We do have the opportunity to have 3 different health systems in North Carolina, with Cone Health being the principal one here in Greensboro area, but we do have Wake Forest Baptist in High Point, and we do have some Novant clinics as well, which is fairly interesting because even in Orange County, it is a majority UNC system. Durham County is a majority Duke. In Charlotte, Mecklenburg area, there is a majority of the Atrium Health systems in Novant. So they do have 2, but we have a high concentration of medical professionals here that we need to take advantage of, and we need to be able to link our community members to all of these services that are provided. It is not enough to have them, but to actually utilize those resources that we have. So that's interesting. In looking back at my work that I've done in Hereford, there was a huge focus there on sexually transmitted diseases and HIV. That entire area probably has the highest rate of STD and HIV transmission than anywhere else in the state. So a lot of our focuses were in that arena. Not to say that we don't need to focus on that here in Guilford, because we do. We need to do that. We have 7 or 8 colleges and universities, so we know that this is the time frame, that the age range in which those happen. So we have an opportunity there to address those things at the right time, at the right age, promote healthy behaviors and prevention strategies. So I think that we're talking about also the racial and the ethnic disparities. I'm seeing that all across the board. So talking about structural racism and the way that it's impacting healthcare and access to health and health outcomes, it's part of the focus that we have in the health department, and it hasn't been a focus just here in Guilford since I came on board, but also in the other health departments that I've worked with and the ones that we partner with as well. So addressing that and making sure that we know how to look at the services that we're providing with that health, racial equity lens, not only to our clients and patients, but also internally with our own team members. It's something that we're continuously working on in trying to address those issues, because we can't effectively serve our community if our own inherent biases are preventing us from doing that.
Right, absolutely. So, absolutely. So I'm going to ask you a couple questions from the chat from the chat box. One is in relation to what you were just talking about. How does Guilford County, how does it compare to other counties in the area or where you've been? Does it have a larger or smaller homeless population? And as we know, that directly affects healthcare.
Yeah, we from what I see, compared to peer counties and the counties that I've worked with, we definitely have a higher homeless population. But that is also directly impacted by the number of people that we have in Guilford County. We can't really take that out of consideration. We are the third largest county in North Carolina with probably a little bit over 540,000 residents. Wake and Mecklenburg, they're just a little bit 1 million. So we're kind of half of them, but we're still the third largest. So the more population that you have, the more of the homeless members of our community you're going to have also. Another reason why we probably have a higher number of homeless is because we have excellent homeless services in Guilford. So a lot of the homeless people in our surrounding areas are coming to Guilford County because of the excellent work that we're doing for the homeless population. And I've worked very closely recently with our COC because of the COVID-19 response, and to make sure that we're putting in place all of these different strategies to protect the homeless population, since we know that they're at higher risk, they're extremely vulnerable themselves, but then they can also expose and be a potential risk for other community members if they don't have a safe and a safe environment for them to complete their isolation period or their quarantine period. So we've developed workflows and operations to address that with our partners at the COC, and that includes all of the different shelters that we have here in Guilford. We work with all of the different partners that are providing homeless services, and I'm sure that continues to be part of our focus at the county level, but I know that each one of our cities, both High Point and Greensboro, are very much aware of this need and the resources that need to go into that area to address that disparity and the, of course, homelessness and transient activities are always going to have a negative impact on somebody's health.
Thank you for that. Another question that came from one of our viewers: North Carolina is one of a handful of states that has not expanded Medicaid, but 39 other states have expanded Medicaid. How would Medicaid expansion resolve some of these issues that you are addressing in your work?
So the way that I look at it is kind of a donut. So it would pretty much take care of some of that donut hole that we have right now. There are so many members of our community that are right on the fringes of being eligible for Medicaid, but they're not there yet. They still have jobs and they are doing a great job supporting their families, and they want to be productive members of our society. They want to put their skills at work, but yet they're just not making ends meet, and they're still not able to pay for health insurance. Health insurance is extremely expensive if you have to pay for it out of pocket. Some of us that are just fortunate enough to be able to be offered health insurance through our jobs and through our employers don't really think about it. Well, we have health insurance, we can pull our card when we go to the doctors and here it is, I'll pay you my copay, or I'll just give you the $2 or the $4 out of pocket cost, and we think that everything is great. But when you actually have to pay for that insurance that you might need, that's the trick there. The way that people would think, or the people think when they have to choose between, am I going to pay my bills and put food on the table, or am I going to pay hundreds of dollars every month for this insurance that I might need, because this is somebody that might be healthy right now, and they feel like they're fine. You know, they don't go to primary care checks, they don't go and keep up with their annual visits, they're working, they're fine. So no, that is not a priority for them right now to pay all of that money to buy an insurance that at some point of time, we don't know when, it might be useful. So I believe that is a conversation that needs to continue to happen, and having the ability to include some of our community members that are on those fringes is going to be truly, truly important. And I did see a question that popped up about the community care network and the work that they're doing. I think that I work very closely with Lisa Duck, who is the CEO of GCCN. I actually sit on their board as well. So I'm very familiar with the work that they're doing. And we also share a building for our dental clinics. They provide dental care services for adults, and we provide dental care services for pregnant women and children. So that was a beautiful partnership that we have put together. So the work that Lisa and her team and the Guilford County Community Network is doing here in our communities is invaluable, and we need to continue to support them, and we need to continue to promote the work that they're doing. But yes, because that's exactly what they're doing. They're taking care of those individuals that are on the fringes, working with professionals and doctors and services in pro bono. They're offering time and hours of their days to provide these, especially specialty services. We know that there are several what we call safety net providers that our community can take advantage of. The health department being one, we provide primary care services. Our federally qualified health center, the one that Michelle Lewis is leading, Triad Adult and Pediatric Medicine, they're also a safety net provider. But then when we're talking about the specialty work that needs to be done, we're really lacking in that area. So Lisa Duck is truly trying to come and fill in those needs as much as they can, but the need is pretty big.
Right. Thank you for answering that. We appreciate it. So as you all know, Dr. Vann is incredibly busy. And so we are going to wrap this up in just a few minutes. But I do want to ask you, Dr. Vann, if you we have lots of people on this call who are involved with nonprofits, who are funders, who are big fans of yours and of the Community Foundation. So if you had a magic wand and you could say to them, this is what we could use, or this is what could make our job in public health better, easier, what would that be? Think big and dream big.
Wow, that is definitely a very interesting concept. And I think that one of the main things that I would like to tell the participants and our viewers is to keep their eyes and ears open to what's going on in our community. Read our community health assessments. Look at the areas that we identify in partnership with our community that are areas of need that we need to focus on. Maternal health, mental health, behavioral health, infant mortality. All of those are listed in our community health assessments. So just be resourceful and research and call me if you want me to just kind of take you into the right direction. I'll be more than happy to do so. Being a voice for public health in our community is also one of those big kind of magic wands things that and I know that I'm not really talking specifically, oh, we would like to have $50,000 to put in this particular program, because right. It's really not that. The most important message that I would like for us to take away from this conversation is to advocate in any and every room that you're in to support public health efforts. If that is with funding different programs, if that is policy change, if it's bringing innovative programs to Guilford County that you are aware of in other areas, we want to hear all about them. So that's how I believe that we can really work this together and have an impact on the work that is being done here. Be on our board. We need community members to be on our advisory board. Be on other boards that are promoting this work and they're focusing on this work to have that direct input or direct connection with the services that are being offered.
Wonderful. Dr. Vann, you're incredible. And I feel so inspired talking to you and hearing and feel good knowing that you're there doing this work.
Thank you.
Love for Kevin to just offer a couple reflections on this this session that we've had here today, and he's put a couple links in the chat box also. So go ahead, Kevin.
Yeah, and you can share my contact information with the rest of the group. I'm always available. It might not be right away, but I'm always interested in working with partners and just hearing in more perspectives or answering questions. I'm always open to that. So you can, email me, text me, call me, anything that I can be of assistance of, or point you in the right direction if I can't be of assistance.
Great. We will send a follow-up email after this session with the link to the recording so that people can forward it. And we'll also include that information of your contact information.
Well, thank you. Thank you so much. And thank you all for being here. I think that having this wonderful group of community members and philanthropists on this call truly fills my heart, and it just tells me that we have so much support in our community, and I'm just so thankful for that. Thank you.
We are thankful for you. Absolutely. Thank you, Dr. Vann.
All right. Well, I hope you have a wonderful day, and I will talk to you later.
Thank you.
Okay. Bye.
Bye. Kevin, you want to offer a couple and then we will log off. Thanks for being here.
That sounds terrific, Emily. So just a few high-level reflections, I guess, and kind of an overview of what was talked about today, just to kind of go back and remind ourselves. I took a few notes, and so kind of we started off with observations from Dr. Vann on coming to Guilford County, and she shared some information that I didn't know, that Guilford County has the oldest health department in the state of North Carolina at 120 years. We then talked a little bit about health equity, which I think was really helpful to kind of frame the conversation for today, around everyone having the opportunity to reach full health and with no one experiencing disparities in the relation of social, environmental, and economic connectivity. I thought that was really powerful. We also talked a little bit about the shifting role of public health here in Guilford County and kind of across the country, from kind of this illness prevention and communicative disease, which is also still covered, of course, but this kind of shift in focus in addressing more chronic issues and social determinants of health that Dr. Vann talked a little bit about. Then we got into a deeper conversation I thought that was really important around how our Black and Brown friends and neighbors are being disproportionately affected on all sorts of fronts, one of which being life expectancy. When we look at one part of the community versus another, zip code to zip code or census tract to census tract, 10 or 15 years in life expectancy, which I think we would all agree is unacceptable. And I think we all have a role and a challenge and a call and a responsibility to step in and to help be part of that solution there. And I'm glad we got to talk a little bit around solutions and ways that we might help. The comparison of Guilford County with other counties and other communities was really helpful for me, just to kind of get a lay of the land as to where we stand locally. We touched on institutional and systemic issues and challenges, which was important. And, one of Dr. Vann's big points, I think, in bringing it home of ways that we can help out was to advocate in any room, in any space that we're in, and using our own voices and our positions and the seats that we sit in. And in the way funding and policy is developed, I think that's really key. And so those are just kind of summary points that I captured throughout the call today. And I wanted to say that, to close my portion, to say that CFGG has been really fortunate to partner with the County Health Department over a number of decades, going back to the, on various collaborations, including the Community AIDS Partnership, that did some extraordinary work during the AIDS epidemic and the years following. And finally, a big shout out to the nonprofit organizations represented on the call and not on the call. The critical role that the partners of the health department play, who are on the ground each and every day and have been year in and year out. Those are organizations, and I see some of your names and faces on the call. I would start listing, but I think I'd get in trouble, so I don't want to leave anybody out. But big shout outs to all the nonprofits who are ensuring that these banners and that this work is carried forward day in and day out. So with that, I'll kick it to you, Emily. Just a note of thanks.
Thank you, Kevin. I appreciate that. This topic is so vast that I thought it was important for us to just hear those last bullet points about what we covered. And so I appreciate you, Kevin. Just as a reminder for all of our guests, this was recorded and you can share it after today. And I will be sure to send you an email with some information in there that you might be interested in. We're gonna plan these maybe 1 or 2 more before 2020 closes, which I think some of us are pretty excited about 2020 closing. So we might do a couple more. So if you have ideas for topics, let us know. And as always, your development and donor services team at CFGG is always here to help you get in touch with some of the organizations you might be interested in, or talk to you more about how the foundation can help you. So let us know, and we hope you all have a happy and healthy Tuesday. Thanks for being here. Bye. You're muted.